Okay, first let's go over the policies that already exist and how recommendations for treatment and duty are made when considering a crew member's ability to fly. One of the first ways is the service-specific aeromedical standard. In addition to regular military testing standards that must be met, there's an even more rigorous testing that must be done in order to qualify as a pilot. For instance, you need to seek medical clearances from the following departments: a cardiologist, dermatologist, endocrinologist, ENT, gastroenterologist, hematologist, neurologist, obstetrics, ophthalmologist, orthopedics, psychiatrist, respiratory, and urologist. Some of the specific things they test for are to make sure a crew member can equalize his middle ear pressure, self-balance, pass a dental exam, that they aren't diagnosed with certain STDs. An EKG must be done. They have to have good blood pressure, hearing, eyesight, and depth perception, to name a few things. Another way to qualify is through an aeromedical waiver. If there is a red flag or concern in one of the above mentioned areas, a request can be made asking for a waiver. It is usually the service member who requests a waiver. However, a commanding officer is also allowed to do so. Each military branch handles their waivers differently, and each case is treated uniquely. Just because the Army approves a waiver does not necessarily mean that the Navy would approve the same waiver request on a different service member. So, when we acknowledge that there are differences among military branches, one of the things we notice from 2006, the Army will now allow requests for waivers. So one of the more notable changes we've seen is the guideline for psychotropic medications. Before, anyone taking an antipsychotic medication would automatically disqualify you from the program, whereas that's not the case anymore. The same is true for SSRIs and SNRI medications. They are still concerned, but they will not automatically disqualify a crew member. Contacting your aeromedical psychologist or flight surgeon for guidance when deciphering between waivers minimizes improper diagnosing and allows for more appropriate recommendations. It's important to keep the psychology jargon to a minimum when submitting a waiver. Not everyone reviewing the waiver may be able to understand the lingo, so it's best to keep it in layman's terms and hopefully get an unbiased review.